Okay. So first of all, I just wanted to say hello, and I already had that wonderful introduction. So thank you. And I'm here to discuss the National Association of Hispanic Nurses partnership with Vot-ER and the work that we're doing out in the community. And so I am Doctora Veronica Vital, and I'm the current President-Elect of NAHN. And I'm very, very passionate about the organization. And I'm going to give you a brief overview of NAHN to have a better understanding of NAHN and the role that we have here. Okay, so NAHN, we've been in existence since 1975, and we've been leading the nation's nursing for the profession for since the Hispanics since 1995. NAHN is a nonprofit organization. It's devoted to ensuring high quality health delivery to Hispanic communities and promoting professional excellence among bilingual and bicultural nurses. So according to the US Census, approximately 19% of the US population is Hispanic, and approximately 5.7% of all registered nurses in the United States are Hispanics. And as you can see, Hispanics are underrepresented in nursing, and we do not mirror our communities. So diversity in the nursing workforce is a priority for nursing as well as for NAHN. NAHN is passionate about empowering and inspiring students to become nurses, and we are committed to diversifying the healthcare workforce to ensure we do mirror our communities. And we are inclusive, and we provide mentorship for all. However, as I mentioned, Hispanics are one of the largest minority groups in the United States, representing approximately 19% of the US population. And again, Hispanic nurses only represent less than 6% of all nurses. So therefore, NAHN, we embrace the opportunity to mentor Hispanic students aspiring to be nurses. Diversifying the nursing workforce can help reduce health disparities and inequalities faced by minorities. And then patients may be more willing to receive or seek care from providers who speak their language and or may share the same culture. Providing linguistically and culturally competent care can enhance the care provided. When patients better understand the care and education that's being provided, they are more willing to adhere to recommended health regimens. So NAHN fosters professional growth and development through providing networking opportunities locally and nationally. We promote engagement in advocacy, and we also offer CEs at our national annual conference. Furthermore, we empower our members through mentorship. And I can attest to the value of mentorship because I, as a student back in '97, struggled. No one in my family, when I was the first in my family to go to college, I was the first. So I actually was struggling getting through college and maneuvering. I didn't know how to go to college. And so I struggled with that. So I almost dropped out of nursing school. And so I was introduced to NAHN, and I was blessed to be introduced to them because they took me under their wing. And mentored me. And so long story short, through mentorship, through all the individuals, the inspiration, the empowerment of being part of NAHN, I don't contribute everything to them, but now I do have my PhD in nursing. And so that is one thing that I can attest to is the mentorship of NAHN. And then I contribute that and talk about the circle of mentorship, because now I have been blessed. I was in academia and I was able to mentor students who were struggling as well, and students who looked like me and who had challenges, and they overcame their barriers as well. And so I love that circle of mentorship model that describes NAHN's mentorship. So I just wanted to share that with you. And then also NAHN is committed to maintaining a culture that promotes learning and leadership development. There are several NAHN leadership opportunities locally and nationally. And then also in those leadership opportunities include like being board of directors, being able to sit on various committees locally and nationally, and then also the chapter leadership. Every individual chapter has their board of directors as well. And so we have those opportunities. And then also members have the opportunity to engage in community service. And then the educational benefits of NAHN include scholarships. We offer scholarships every year. And then also we provide tuition discounts from our academic partners. And then we also offer webinars for our members. And then also members can be actively engaged in research as well. And we mentor them in that process as well. So we value familismo. And so the way I look at it is we're not just an association, we're a familia. We come together, we support each other, and we're a family. So that's another benefit of that. Sorry. And my thing is just going all over the place. So sorry about that. I'm not sure why it's doing that. It's really bouncing. Sorry. I don't know why it's not going to the next one. Okay, sorry about that. So then here, NAHN has a network of more than 40 chapters across the nation, with multiple chapters in development. The chapters are actively involved in creating a culture of health in Hispanic communities and championing issues that impact the profession of nursing at a local, state, regional, and national level. And we do have more information about how to start a chapter if anyone's interested in that. So NAHN is a collective voice of over 1,650 nurses, healthcare professionals, students, and academic leaders from across the United States. And this chart kind of reflects our current membership here. Okay. And as I mentioned, NAHN is engaged. We are engaged in equity and social justice as well. And so NAHN is the voice of Hispanic nurses and the disparate Hispanic health concerns of our community. And Latinos are burdened and disproportionately affected by many health conditions, such as those listed here. Alzheimer's, definitely we saw the impact of COVID-19 on our communities of color. Also asthma, heart disease, cancer, and then diabetes, obesity, and then I won't list the other ones, but there's so many more health disparities that our communities face. So these disparities are influenced by social determinants of health. And the Healthy People 2030 defines social determinants of health as the conditions in the environments where people are born, live, learn, work, play, worship, and age that affects the wide range of health, functioning, and quality outcomes and risks. Social determinants of health are non-clinical factors that impact a person's health. And some of the examples of social determinants of health include like income and social protection, education, unemployment and job security, work-life conditions, food insecurity, housing, basic amenities and the environment, social inclusion and non-discrimination, and then also the access to affordable health care. So that's also very important. So I'm sure many of you have heard of social determinants of health. And these social determinants of health have a profound impact on health and well-being. And just recently, the American Medical Association held a House of Delegates meeting in June of 2022, and they endorsed a policy acknowledging voting as a social determinant of health. So now voting is being recognized as a social determinant of health. And it has the potential to be the most powerful social determinant of health. So despite the pandemic in 2020, a record number of marginalized voters turned out and voted across the nation. They overcame the adversities of voting, such as barriers to accessing the ballot box and voter suppression. An estimated 16.6 million US Latinos voted in the 2020 national elections. This was approximately a 30.9% increase from 2016. And it is projected that the US population will increase by 79 million people by 2060, with the population of 2 or more races being the fastest growing racial or ethnic group, followed by Asians and Hispanics. And it is estimated that by 2060, 1 in 3 Americans will be a race other than white. Furthermore, by 2060, Latinos are projected to account for 27.5% of the US population, and this will translate to the increase of Latino voters across the nation. So the diversity of Latinos equals political power. This was evident in our 2020 elections. It's important also to understand that Latinos, are not homogenous, and that US Latino voters are diverse by age, by immigration status, by the country of origin, and state and local geography. So it's really important to take that into consideration when addressing Latino issues. Also in 2016, 44 million people were foreign born, with nearly 50% being Hispanic or Latino. It is estimated that by 2060, 69 million immigrants will be living in the US. So migration trends are especially sensitive to policy and economic circumstances in both the United States and migrants' country of origin. And Latinos are often left out of the conversation when it comes to shaping policies. So this is important. Latinos are a dynamic group, and as Latinos, the population, as the Latino population continues to grow, so will their influence on the makeup of our nation. So it's important that the communities vote in local races and in their upcoming elections. One of the examples that I like to give is here in Arizona. Back in 2000, Proposition 203 passed, and it was English only in our schools. And at that time, I was younger, and I really didn't get involved in voting. And I just remember a lot of our family members, a lot of our friends, everybody was upset because this proposition passed. So when I was talking to my grandmother, we talked about it, and I, mentioned how we were upset about it. And she looked at me and she said, "Did you vote?" And I said, "No, Nana, I didn't vote." And she said, okay, well, then you really can't complain. And so it was kind of like, it was a kind of like a reminder to, okay, now I need to get involved. And so since then, she's made an impact on me, and I voted since. So very important to make sure that our voices are heard. So why should NAHN be involved in civic engagement? Well, first, I'm very proud to share that according to a Gallup poll, nursing has been ranked the most trusted profession for 20 years. And why is this important for our discussion today? Well, NAHN is embedded in communities across our nation, and our chapters are engaged in the grassroots efforts to advance health equity and eliminate health disparities. They are champions in our communities and have established trust with their community members and key stakeholders. And it is imperative for our communities to trust us when we are promoting civic engagement. So some of the non-objectives that correlate to this discussion of voting include to promote the safety and the quality of health, the healthcare delivery services for the Hispanic communities, identifying barriers in implementing and delivering health services to Hispanic consumers, and recommended appropriate solutions to local, state, and federal agencies. And then also we advocate for policy changes and perspectives related to health, the Hispanic healthcare needs. And then we advocate to local, state, and federal agencies in order to impact the allocation of resources for Hispanic population. And these also are aligned with Vot-ER vision of healthy communities powered by the inclusive democracy. So beyond awareness is engaging in advocacy, and that's through encouraging individuals to vote. And due to the profound impact of voting on health equity, NAHN has acknowledged the importance of partnering with Vot-ER. We have engaged in activities disseminating Vot-ER information to non-members. So Vot-ER guest speakers attended our chapter president's meeting, and the guest speakers spoke on a pilot project for the chapters for disseminating and utilizing Spanish voter the Vot-ER lanyards. And then also there was a call for chapter members to engage at a local level. So the chapters were able to contact the team, the Vot-ER team, and do work through their communities as well. And then also Vot-ER information was disseminated at our non-national conference this July in Miami. And then also members receive Vot-ER information, and the link was provided to vote to the Vot-ER website via our newsletter, which is our digital newsletter. So it's sent via email to all membership. And then also, the dissemination of voter information was offered to community members, and this was done through chapters being actively engaged at a community level. And one of the examples is our Milwaukee chapter partnered with the Vot-ER team, who presented at a monthly meeting on and did education on how to order badges and lanyards, and how to integrate discussions of voting into the patient's visits. They also explored opportunities for increasing membership, civic engagement, and awareness. And then another way to disseminate information to community members or patients is through Vot-ER Civic Health Fellowship. This integrates voter registration into the healthcare system, the healthcare delivery system. And a call was sent out to invite our non-members to apply for the fellowship. And we do have some of our non-members who are actively engaged, and they are Vot-ER Civic Health Fellows. And as healthcare providers, they partake in civic engagement while working in their healthcare settings. They have these QR codes on their badges, and they also utilize voter tools to engage patients in the discussion of voting. So again, we remain nonpartisan, and we just disseminate the information and help people either register to vote and or be informed of voting. So the partnership is mutually beneficial for both partners, NAHN and Vot-ER. And through this collaboration, NAHN has assisted in promoting the vision of Vot-ER, which is the healthy communities powered by an inclusive democracy. And then NAHN has partaken in civic engagement, which helps NAHN fulfill our mission of advancing the health in Hispanic communities. And then voting empowers community members and patients to have their voices heard, and then also to have their votes count. Membership is also empowered to advocate for our communities. Advocacy, healthcare providers move beyond increasing awareness. So they're just not increasing awareness. We're actively engaged in advocacy and civic engagement. So now being part of Vot-ER, we're able to assist our communities to vote, to register to vote. And then having voting resources available at clinical settings eliminates some of these barriers of registration, of registering to vote for our communities. So voting influences policy development and community-led policy changes, and implementing a policy that the population will not access is not beneficial. Therefore, allocation of resources is important. Voting at local levels is vital to ensure that the adequate allocation of funding for sources are appropriate to address the social determinants of health, especially impacting our communities. So racial and ethnic minorities and people with low incomes are more likely to face health inequalities and poor health outcomes. Interventions and policy changes at the local, state, and federal level can help reduce these health and safety risks and ultimately promote health equity for our marginalized communities. So it's important to empower our patients to vote. And then also, here's a picture of some of our conference. We had a great turnout at our conference. And so one of the other things that I want to recognize is we acknowledge that it is imperative for us to continue our partnership with Vot-ER. So then that way we can make sure that our voices are heard, our communities are heard, and that the social determinants of health are being appropriately addressed as well. So we are having a conference in Portland, Oregon, July 11th through the 15th in 2013. So we invite you to join us at our conference. And that is my summary of our partnership with Vot-ER. So thank you.